If you're in your third trimester and your belly is starting to feel really heavy, this is one of the ways I've been using KT tape for a little extra support. I'll link the kinesiology tape I use in the description below, including a sensitive skin version, but for this you'll also need a pair of scissors. First, I'm measuring and cutting my kinesiology tape into strips. To do this, I'm going to start by placing the tape just beside one of my hips and wrapping it around until it reaches about the level of my belly button. Using that piece of tape, I'm then going to measure another piece of tape of the same size for the opposite side. Next, I'm going to cut 2 more pieces of tape to help support the front of my bump. For this, I'm going to start by holding the piece of tape just above my pelvis up to the level of my belly button. And then once again, I'm going to cut 2 pieces with this length of tape. We've now measured and cut the 4 pieces of tape we'll need for this taping option. I'm now using the scissors to cut and round the corners on each side of each piece of tape. This helps keep the edges from catching on clothing and peeling up, allowing our tape job to actually last a little bit longer. Before applying the tape, make sure your skin is clean and completely dry. Avoid lotions or oils beforehand so the tape can actually adhere properly. Because we want a bit of a lifting effect with this taping option, we're going to start by applying all of our pieces of tape towards the bottom end of our bump. For this technique, I'm going to start by pulling back the backing of the tape slightly so that I can have an anchor end that starts at the bottom of my bump towards one of my hips. In this area, you're going to have no stretch on the tape. That way it sticks really, really well. And then for the middle portion of the tape, I'm adding a little bit of stretch just to get a lifting effect with the tape that we want. And then once again, the other end of the tape up towards my rib cage is being anchored with no stretch. And then you just want to rub that really, really well as the adhesive on this tape is heat activated by friction. You'll repeat the same taping technique for the opposite side, allowing you to have that lifting effect from both sides. I really like these 2 pieces of tape. If you are experiencing any around ligament pain or pubic symphysis pain, I really love that it just provides a little lift. You are looking for gentle support here, so you don't need to pull the tape to its full stretching capacity. Just do it to your comfort level. Next, I'm adding the 2 additional strips across the front, starting from the lower end of my bump on one side of the bump, and once again anchoring with no stretch, adding a little bit of stretch through the middle piece of that tape, and pulling up, lifting the bump as I add that on. And I'm going to repeat the same thing on the opposite side. Once the tape is on, you should still be able to move and breathe comfortably. It shouldn't feel restrictive, painful, or like it's tightly bracing your belly. If you notice any itching, burning, redness, or any other skin irritation, remove the tape. And when you do take it off, go slowly. I personally find removing it in the shower or using a little oil can make it much more comfortable, especially with sensitive belly skin. Here's what the finished application looks like. Make sure to like and subscribe for more pregnancy, mobility, and rehab content.